One of the things that we knew about utilization around using urinary catheters in ICUs, it's extraordinarily common. Almost every patient was getting a catheter here a year ago. Unfortunately, the care of these catheters has become very inconsistent all over the country, and we have seen a real rise of infections.
So the risks of having a Foley catheter placed are increased rates of urinary tract infection, which means increased antibiotic use, which leads to increased antibiotic resistance. If the patient's hospitalized, a Foley can also lead to increased costs, increased length of stay in the hospital.
The challenge with Foley utilization in the critical care really has to do with the fact that it's a mentality we have. It's almost a learned behavior.
We seek to be consistent, and that can be a real downfall in healthcare, because really what has to happen is we have to look at the patient individually. One of the first things that we did at this organization was really start at the ground level and speak with the nurses about patients that had gotten urinary tract infections from their catheters right here at our hospital, and we told their stories.
They understood the purpose and why we're doing it, because that's the other thing, is bringing that evidence-based education to them, saying, you know, geez, 1 in 10 people will die from their CAUTI. This can save lives.
So we work with standardized infection ratios, and the data is shared at every team meeting. We found that tracking device utilization for the ICU, we were at about the 90th percentile consistently. And after interventions, we were able to drop down to about the 50th percentile. So it really has been a tremendous change, but a change in culture and identifying inappropriate use, and then really showing the data and the science to indicate that we could do without.
Yes, we as a critical care made some great strides, but it wasn't us independently. It's a hospital-wide, it's a team effort from every department.
The doctors were involved, emergency services, ICU, the floors.
Our chief nursing officer came on board on the team, and she was actively engaged in our team. And it really does make all the difference in the world.
Leadership has got to show up to the table. They've got to go to the meetings. They've got to slog through the work.
The leadership has supported reducing catheter infections by really pushing forward the new products and doing the research on different companies and different product brands that we can use, and then bringing them to our department for us to trial.
They've got all the personnel trained, they all cooperate with each other, and the equipment and the place is just marvelous.
Well, as a nurse, you know, inherently we want to do good. So to know that some of the simple devices that we utilize can actually cause harm, you know, that's a concern.
That motivates people to make changes and not just to do what's easy for them, because they want to do what's best for the patient and for the hospital as well. That's important.
It's a package deal. Data's powerful, but what's even more powerful, what potentiates the data, is the reality of what happens to the patients. That's what really drives the improvement.
I'm grateful to see the change and the culture change in my department. I'm so grateful to see less infections.
I take these infections personally. These are patients, these are people. So we want to make sure our patients are protected.